Hello, my dear nursing aspirants. Welcome you all to the Master Nursing classes. Here in this particular today's video, I am going to describe and details our entire important topics and high yield content for our upcoming Norcet exam. Yes, welcome you all once again to the Master Nursing classes. In the entire session, I am not going to waste your single second because I know the value of the time. So when we respect the time, definitely that time will come where everyone will respect us. So, and in the aspirant's journey, every second matters, and every minute matters, every hour matters. So, whatever the content I am going to cover in the next 1 hour, that is most important content, and there is highest chance of this striking the questions from the direct questions or from the explanation and from the high yield rapid revision points what I am giving here and what are the key points I am giving here. From there, the questions will strike definitely in the exams. Students, these particular crash course videos, it may describes your up to 50 marks in the exams, and it is up to you to score the 10 more marks in the prelims to get qualified, right? So I am giving you a free bonus content from my side. So actually this content is preferred for the crash course, but I am giving here it is a complete free. Okay, so as I told in the previous sessions also, I am not going to waste in a single minute of the time. So we'll start the today's session with a beautiful motivational quote. Yes, the pain you feel today is the strength you feel tomorrow. Bacho, it is a that particular phase of our time where we have to work hard and very hard. I know you people are continuously studying for the 8 hours, 12 hours, 10 hours in your homes, in your libraries, continuously. And if one more strength will be coming in your exam preparation in the form of the crash course and rapid revision point by your master nursing classes, it definitely keeps your name in the selection list, in the prelims, and in the rank list in the mains. So believe me, believe the content what I'm giving here, it's updated. Okay, whatever the key points I'm telling here, take a note of that padafat, then revision immediately after the class. Okay, not like we will study for 1 week, then after that we will revise entire thing. No, whatever the points I'm telling here, note it down, revise here. Okay, otherwise take a screenshot and immediately after the class padafat revise it. After that you can delete, no problem. Right, so without wasting the time, we will start the today's session. There is a beautiful motivational quote coming in front of you all. So this question particularly strikes in the last CRE exams, not in the recent CRE, last CRE exams, and in the Norcet exams repeatedly 3 to 4 times. So this is the most important thing. That is the stages of the xerophthalmia given by the World Health Organization. Okay. So what is the stages of the xerophthalmia given by the World Health Organization? Everything I will explain. Just try to give a response to this particular question here. Which of the following describes the second stage of xerophthalmia in WHO classification? Second stage of the xerophthalmia in WHO classification. WHO classification में second stage of the xerophthalmia कौन सा है? So that is your question here. Option A, the corneal scarring. Option B, the conjunctival xerosis, where the conjunctival means the conjunctiva and xerosis means the dryness. Okay, wherever the word xerosis comes, it indicates the dryness. Okay, so very important word. Then loss of the vision completely, and option D is the night blindness. Bacho, which is the first stage if the examiner is asking? Which is the first stage of the WHO stages of the xerophthalmia? The first stage is the night blindness. And if the examiner is directly asked, here the second stage of the xerophthalmia. So that is our conjunctival xerosis is the second stage of the our WHO classification of the xerophthalmia. And corneal staining is the second last stage, and complete loss of the vision is the last stage. Let us quickly revise the WHO classification of the xerophthalmia. Right? So here the first stage is the night blindness. So this question will come, and this question came already. So that is the first stage of the WHO classification of the xerophthalmia is the nyctalopia or the night blindness. Okay, nycta. Here the nycta stands as the night. Okay, opium is loss of the visions. Okay, so night blindness and nyctalopia is the first stage of the WHO classification of the xerophthalmia, and the second stage is very very important. That is the conjunctival xerosis. Sir, bite or spot. This is which stage, sir? It's an third stage, and it's very very important. It's an third stage of the xerophthalmia, and it's very very important. It's very very important, bacho. Right? So then corneal xerosis. Here, bacho, the conjunctival xerosis is there. Don't confuse. Okay? So it's the dryness of the conjunctiva. If the conjunctiva is dried and whiter spot came, still we have not treated the vitamin A deficiency, means that is it will go for the corneal xerosis. Yes, why everything is happening here? It's everything is happening here because of the vitamin A deficiency. It's everything is happening here because of the vitamin A deficiency, right? So first stage is the our night blindness, second is the conjunctival xerosis, third is the bitoid spot, fourth is the corneal xerosis, and the fifth is the keratomalacia. Sir, what it meaning, sir? What is the meaning of the keratomalacia? Kerato means the cornea. Malacia means the softness. Where we will see the same term, that is the osteomalacia. What is the meaning of the osteomalacia? Osteo means the bone, the malacia means the soft. Yes, the softening of the bone due to the deficiency of the vitamin D in adults, we call that one as in the osteomalacia, and deficiency of the vitamin D in the children, so we call that one as the rickets. Right? It's important. Right? Very very important. So the keratomalacia is the fifth stage of the WHO classification of the xerophthalmia. Then comes to the corneal scarring. Then comes to the last stage. There is the xerophthalmic fundi. So what it xerophthalmic fundi? So fundi is the our retinal part. As of you know that we are having the three layers in the eyes. Outer one is the yes. Total three layers. Which one is the outer layer of the eye? This is the sclera, choroid, and retina. It's retina, it's choroid, and it's in sclera. So very very importantly three layers. So innermost layer is the retina, and retina is also called as sensory neuronal layer because the ophthalmic nerve will be direct in touch with the retina. So that is what called retina is the sensory neuronal layer of the our eye. Very very important. So here we are having part in the eye that is called as the fundus. So if that fundus is got degenerated, there is complete loss of the vision. So complete loss of the vision or the xerophthalmic fundi is the last stage. Complete loss of vision or the xerophthalmic fundi is the last stage. Bacho, don't neglect this one, it will strike in the exam. So all you people have to remember that the first stage is the nyctalopia, and the fifth stage is the keratomalacia, and third stage is the bitoid spot, and conjunctival xerosis is the second stage. So let me come to the next one. It's very very important slide. Take a screenshot of this one. That is the vitamin A prophylaxis, and it is included in the national immunization schedule as well. It's a part of the national immunization schedule. Okay, a national immunization schedule may be included here. Vitamin A prophylaxis give it's always given with a measles vaccine. Okay, at the 9 month, so we have to start the measles vaccine. Okay, so at the 9 month, very very importantly, this is the dose that is repeatedly striking in the exams. Let us quickly revise the vitamin A dose. If the baby is less than 6 months, we have to give 50,000 international unit of the vitamin A. If the baby is belongs to the 6 months to 1 year, means 1 lakh international units. And here I told you, usually we start at the 9 months. So the first dose is the 9 month, means it belongs to the 6 months to 1 year. So the first dose is the 1 lakh international unit is the first dose. Very very important. And if the baby is more than 1 year, from the second dose onwards, we have to give the 2 lakh international units. In special case, this is the special case. Sir, what is the special case? If the baby is more than 1 year and his weight is still less than 8 kg. Baby is more than 1 year and weight is less than 8 kg. So now what we have to give? Just we have to give 1 lakh international unit. Okay? 1 lakh international unit. Bacho, look at this one. Here more than 1 year I told 2 lakh international unit. But this is a special case. If baby is more than 1 year and the baby's weight is less than 8 kg, go with the answer. There is the 1 lakh international unit. Very, very important. Okay, sir, how the question will come? The question will come like this. A baby of the 14 month with a weight of 7 kg. The nursing officer wants to give the syrup vitamin A orally to the baby. So what is the dose of the vitamin A? So the dose of the vitamin A here, because the baby is 14 months means more than 1 year and the baby's weight is less than 8 kg. So the answer is 1 lakh international unit. So this is the special case. And usual case, in usual case, if the baby is more than 1 year and weight is more than 8 kg, so go with the 2 lakh international unit is your answer. Very, very important. Okay, so total how many doses we have to give? Total 9 mega doses we have to give. Okay, so what is the gap between the each and every dose? So there should be a gap of the 6 month between the each and every dose. Okay, so between the 9 months to 1 year, first dose will be given, that is the 1 lakh international unit. And from the second dose onwards, 2 lakh international unit is our dose of the vitamin A. So every 6 months we have to repeat. Okay, till the 5 year. Till the 5 year, every 6 months we have to repeat. So total we have to give the 17 lakh international unit of the vitamin A within 5 years of the baby. Okay, it will help very, very importantly. The question came recently. Total how many doses need to give? 9 mega doses. Okay, what is the gap between the first dose, second dose, and each and every dose? So between the each and every dose, there should be a gap of the 6 month. First dose should be given with at the 9 month. Very, very important. It is given always with the measles vaccines. It will help. So let me comes to the image based questions on this one. Look at this, bacho. What is the image of this one? So this image, what it indicating? So are you able to focus here this area? So this is the epithelial layer on our outer layer. So that is what we call as the outer layer is the sclera, and epithelial layer or the mucous epithelial layer on the sclera is the our what we call that one conjunctiva. Conjunctiva. So are you able to see the conjunctiva? Yes, here the complete dryness is there. So this indicating the conjunctival cirrhosis. It is very, very important. And here is the white spot. Are you able to see the dirty white mark here in the eye? Here, look at this particular part. Here is an dirty white mark. So here is the dirty white mark in the eye. So this is what we call as the whiteout spot. What we can say this one is as in the whiteout spot. So where the whiteout spot will be seen? The whiteout spot will be seen in the vitamin A deficiency in the third stage of the WHO classification of the Xerophthalmia. It's very, very and very important, right? So here is the next question for you all, bacho. Again, consideration very important question. So which condition is often associated with severe thiamine deficiency? Here is the severe thiamine deficiency in chronic alcoholic. Bacho, the question will come like this only. If the examiner want to ask the question on the thiamine, it will go like this on the patients of the alcoholism, and he will come like this and he will ask the question. What is sir this like that like? So that like means always who the patient who is taking the alcohol chronically, for that patients there is decreased absorption of the thiamine is there, and the thiamine is the vitamin B1, right? So here what happens, the thiamine is deficient for the chronic period, means the thiamine is the neuroprotective and cardiac protective vitamin. So it's very much necessary to protect our cardiac system and our brain. If in case due to the chronic alcoholism, the patient comes with some memory problem, some psychotic problem, some changes in the behavior, means the brain is affected, and some edema and all, means the heart is affected. So let me clarify the thing what happening here properly with a sequence, so that will definitely helps you in the exams. Okay, so let me clarify that one. So when the patient chronically takes the alcohol, so there is decreased absorption of the vitamin B1, that is the thiamine. Okay, that is what we call thiamine. So the thiamine is get deficit, means we call this one as the berry berry. Okay, so in the berry there are two types of the berry are there. So one is dry berry, another one is wet berry. So dry berry damages the brain and nervous system, and wet berry damages the cardiovascular system. So the classical symptoms of the dry berry is the change in the memory and change in the uh, cognitive functions. And the classical symptoms of the wet berry is the, yes, that is the edema. That is the edema because of the heart failure. Very, very important. Bacho, just the questions came in the exams like dry berry affects which system of the body? The dry berry affects the nervous system of the body. And wet berry affects which system of the body? The wet berry affects the cardiovascular system of the body and mostly damages the heart. Okay, so which is the neuroprotective and cardiac protective vitamin? The neuroprotective and cardiac protective vitamin is the thiamine, that is the vitamin B1. Okay, so this wet berry, if we left untreated, it may go into the next level of the problems in the acute condition. In acute condition, it will cause us the vernix encephalopathy. It will cause us the vernix encephalopathy. In the chronic condition, it causes the Korsakoff psychosis. So both together we call this one as the Wernicke-Korsakoff syndrome. This Wernicke-Korsakoff syndrome happening again with the thiamine deficiency. This happening again with the thiamine deficiency in the patient with the alcoholism. Very, very important. Okay, sir, how the questions will arise in the exams? The questions will arise in the exam like this. The patient of the 46-year-old, he admitted in the general medicine ward with a change in the memories, and there is a change in the behavior and change in the uh, like cognitive functions, and there is a history of the chronic alcoholism. So which vitamin the doctor may prescribe to control the symptoms of the patient here? Yes, the which vitamin? That is the thiamine is the vitamin. Sir, how we have to give the thiamine, sir? Yes, injection thiamine 200 mg in 100 ml NS. So this is the dose usually used in the clinical practices. Okay, so initially 100 mg. If not responsive, we have to go for the 200 mg. And this is the usual dose we have to use in the clinical settings. Very, very important. There is no need of remembering dose. Just remember the thiamine, Wernicke-Korsakoff syndrome, the dry berry and wet berry, and which part of the brain it affects mostly and mainly. Okay, and how the questions will comes and how you people have to think. Okay, so let me solve this question here. So which condition often associated with a severe thiamine deficiency in chronic alcoholism? Yes, are you people able to answer for this one now? Yes, that's the Wernicke-Korsakoff syndrome is the oftenly associated with the severe thiamine deficiency, and it's important. Okay, so then what is osteomalacia? Already I have discussed this one. Osteo stands here is the bone, malacia stands here is the softness. Okay, that is what we call as the bone softening. Okay, bone softening. So this happens because of the vitamin D deficiency. Okay, so vitamin D is responsible for the absorption of calcium, and calcium is the abundant mineral which is there in our bone. So there is vitamin D deficiency, there is no absorption of the calcium, there is no absorption of the calcium means yes, our bone become weak, bone become weak and bone become soft. So the soft bone or the weak bone in the adult we call as the osteomalacia. Hope it's clear. The deficiency of the vitamin D in the children's we call that one as the rickets. Okay. So then comes to the next point. That's the pernicious anemia. So what is the pernicious anemia? Yes, which deficiency causes the pernicious anemia? Deficiency of the vitamin B12 causes the pernicious anemia. Remember the classical picture of the pernicious anemia. That is the red BP tongue. The tongue become red, the tongue become BP means the red BP tongue is a classical picture of the vitamin B12 deficiency. That is the pernicious anemia. It's very, very important for you all, right? So we have discussed a lot of the questions that is most important. So now it's a time to answer to you people. So try to answer for this question. The patient which is there with the chelosis, that's the angular stomatitis. Look at this image. So at the angle of the mouth, there is inflammation of the mucous membrane. So that is what we call as the angular stomatitis. That is the angular stomatitis. And the patient is having the glossitis. That is the infection and inflammation of the tongue is called as the glossitis. And from the mouth, we are getting the fish or the fishy odor from the mouth. Okay. So, and along with that, there is infection, inflammation of the mucous membrane of the oral cavity is also there. That is what we call as the stomatitis. What is the stomatitis? Stomatitis is the infection and inflammation of the oral mucous membrane. That is what we call as the stomatitis. Then glossitis is the inflammation of the tongue, is the glossitis, right? What is the gingivitis? Gingivitis is the inflammation of the gum. Our gum is got inflamed means we call that one the gingivitis. Oral mucus is inflamed means we call that is the stomatitis. Only tongue is inflamed means we call that one as the glossitis. Okay, so there is cracks over the cornea of the mouth. We call that one as the chelosis or the angular chelosis, or we can say angular stomatitis also. And when you see the tongue color, it's in magneta colored tongue. Very, very important. That's the magneta colored tongue, and there is dermatitis also evidenced here. So, because of the which vitamin deficiency? Yes, can you anyone able to answer for this one? Fadafat? Yes, all these symptoms. These are all the classical pictures. From here only the questions will comes. Okay, so angular chelosis is a classical picture of the which vitamin deficiency, or the stomatitis, glossitis, and fishy odor from the mouth is a classical picture of the which vitamin deficiency, or the magneta colored tongues seen in the deficiency of the which vitamin, or the seborrheic dermatitis. Yes, can you? Yes, that is the correct answer. All people are choosing. That is the yes. Which vitamin? Vitamin B2. It's in deficiency of the vitamin B2. That is the riboflavin deficiency. What we call that one is the riboflavin deficiency. Yes, very, very important. And some in some book they can mention riboflavinemia. Okay, means the deficiency of the riboflavin in the blood. Okay, very, very important. Remember this particular point. That's the magneta colored tongue. Okay, so magneta colored tongue seen in our vitamin B12 deficiency, B2 deficiency, that in the riboflavin or the riboflavin deficiency, very, very important thing. Okay, so then angular chelosis is the classically repeatedly asked questions. Okay, so yes, I hope it's clear for you all. Look at the image. This is what you call the magneta color tongue, right? So this is the angular chelosis. The image based questions may comes in your exams, right? So now give the answer for this one. The patient is having the dermatitis, diarrhea, dementia, and death. 4 days. Plus, when you examine the body, because of the dermatitis, there is necklace. Are people able to see the necklace here? The necklace, this black color part, we call this one as in the casal necklace. What we can say this one as in the CASAL, casal necklace. Very, very important. Okay. So this casal necklace also evidenced. So this is the deficiency of the which vitamin? Yes, that is the vitamin B3. So we call this one as in the niacin deficiency. Okay, so very, very important. The 4Ds, the 4Ds in the niacin deficiency, or this niacin deficiency we also called as the disease called as the pellagra. Okay, so it's important for you all. The pellagra is important for you all. Okay, so the question will come like this here. Which of the following is not a part of the 4Ds of the pellagra? Okay, yes, that is our. Which of the following is not a part of the 4Ds of the pellagra? They will give the question and they will mention dermatitis, diarrhea, dementia, and another one word like disease, or another words on the D they can give. Okay, so consider these are the 4 days of the dementia. That is the death, dementia. Sorry, 4 days of the our pellagra. Okay, death, dementia, diarrhea, and dermatitis are the 4 days of the dementia. Sorry, 4 days of the pellagra. It's very, very important. And casal necklace is the classical picture which will be seen in the severe niacin deficiency. It's very, very important for you all. Okay, so it's important. So here's the next question. So what is the primary cause of peripheral neuritis in patient taking the isoniazid? So what is the isoniazid? Isoniazid is the anti-tubercular therapy drug. Okay, it's an ATT drug. Very, very important. So when the patient takes the ATT drug, the special isoniazid, what happens here? There is classical side effect, that is the peripheral neuritis. Yes, classical side effect, peripheral neuritis. The question will come from here only. Okay, so which of the following anti-tubercular drug is having the side effect of the peripheral neuritis? Yes, that is our isoniazid is having the side effect of the peripheral neuritis, where the patient complains of the tingling, pricking, and numbness sensation in the peripheral limbs and hands. Okay, that is what we call as the peripheral neuritis in patient who is taking the isoniazid medicines in the TB treatment. Okay, so when there is peripheral neuritis in the isoniazid, so what is the reason for that? So option A is telling that direct neurotoxic effect of the isoniazid on the nerves? No, it is not having any direct neurotoxic effect. Option B is telling that vitamin B6, that is the pyridoxine deficiency induced by the isoniazid. Yes, it's very, very important. Vitamin B6, that is the pyridoxine deficiency, which will be caused by the isoniazid. So very, very important. So this will be the correct answer, because the isoniazid is the medicine which decreases the absorption of the vitamin B6. So whenever giving the anti-tubercular therapy, always along with this give the tablet Benadryl. What is that? Tablet Benadryl. So tablet Benadryl or the tablet pyridoxine or the tablet vitamin B6, all are same. Okay, so another name of the vitamin B6 is the pyridoxine, and usually used brand name is the Benadryl. Okay, the examiner will throw these two questions: vitamin B6 and pyridoxine. So if you are giving the vitamin B6 and pyridoxine along with ATT, there is less chance of the peripheral neuritis. It's very, very important, right? So the next question is here. Yes, I want answer from you all. So please try to respond to the question. A severe deficiency of the vitamin B5 is known as which syndrome? These questions is important. Vitamin B5 deficiency will causes the, yes, option A, Wernicke's Korsakoff syndrome. This is the deficiency of the vitamin B1. That is the thiamine. Beriberi, again vitamin B1. That is the thiamine deficiency. And yes, the option D remains here as the burning feet syndrome is a classically seen in a patient with a vitamin B5 deficiency. It's important. It's important. Okay. So here's the next question. So which of the following is the major consequences of the untreated vitamin C deficiency? What happens here? Vitamin C deficiency is there. Vitamin C deficiency is there. If you have left it untreated, you are not treating that one properly. What is the major consequences a patient may face? Major problem a patient may face here. Okay. So विटामिन सी का डेफिशिएंसी हुआ है और आप ट्रीटमेंट नहीं कर रहे, सो उसका कॉन्सिक्वेंसेस और डेंजरस इफेक्ट क्या हो सकता है पेशेंट के ऊपर. ओके, ऑप्शन ए इज द डिक्रीज्ड बोन मिनरल डेंसिटी. हो सकता है क्या? नहीं होता है, क्योंकि बोन मिनरल डेंसिटी डिक्रीज हो रहे तो इसका कारण है सो विटामिन डी का डेफिशिएंसी. विटामिन डी डेफिशिएंट है तो कैल्शियम ऑब्जॉर्प्शन नहीं होगा. कैल्शियम ऑब्जॉर्प्शन नहीं हुआ तो और बोन का मिनरल डेंसिटी डिक्रीज हो जाएगा. तो ये विटामिन डी का है, विटामिन सी का नहीं. सो आई एम एलिमिनेटिंग ऑप्शन ए. ओके, सो ऑप्शन बी इज इम्पेयर्ड वुंड हीलिंग. यस, हो सकता है. क्यों? क्योंकि अ मेजर और द मेन important vitamin for the formation of the collagen in the wound healing process. If the collagen formed early, the wound will heal early. Okay, so it's very very important. If the collagen is forming early, the wound will heal early. So vitamin C is the major vitamin which is responsible for the collagen synthesis. Okay, so if the collagen formed early, the wound will heal early. So the deficiency of the vitamin C may lead to the impaired wound healing, and that wound may get converted into the chronic wound. Okay, so the scenario based questions may arises from here. How means a patient with a long abdominal wound comes to the OPD. Sorry, long abdominal wound which is there in the post-operative ward. The surgeon comes to the round. As a nursing officer, what or which vitamin you will expect from the doctor to prescribe here? कैसा आएगा क्वेश्चन? एक लॉन्ग अब्डोमिनल वुंड का पेशेंट पोस्ट ऑपरेटिव वार्ड पे है, तो सर्जन राउंड्स के लिए आया. एज अ नर्सिंग ऑफिसर आप कौन सा विटामिन को एक्सपेक्ट करता है कि डॉक्टर अभी प्रिस्क्राइब करेगा? यस, लार्ज अब्डोमिनल वुंड है तो पोस्ट ऑपरेटिव वुंड में वुंड हीलिंग प्रमोट करना बहुत बहुत इंपॉर्टेंट काम होता है. इट्स वेरी इंपॉर्टेंट वर्क टू promote the wound healing in the post operative period. So we will expect to from the surgeon to prescribe the vitamin C, or in general we can say that is the tablet lim C. It's a chewable tablet, it will come. Okay, yes, the patient can chew this tablet lim C or the vitamin C. It's very very important, right? So हमारा ऑप्शन ये तो आंसर नहीं है. ऑप्शन बी is the correct answer here. Okay, there is no any nerve damage in the vitamin C deficiency and no liver dysfunction. Okay, so here is the next question for you all. So yes, which of the following is a major consequences again if the untreated vitamin C deficiency? So इसमें आंसर दीजिए. Yes, just now we have discussed vitamin C is responsible for the formation of the collagen. So if the collagen is there, the wound will heal early. If the vitamin C is deficiency, no collagen, there is impaired wound healing will be there. Yes, this point is clear, sir. And iron deficiency anemia, yes, is it happens? Yes, sir, happens, sir. Why? Because vitamin C is responsible for the absorption of iron. If iron is not there, vitamin C is not there, so there is decreased absorption of the iron. So decreased absorption of the iron means the iron deficiency may happens. Yes, this is also happens, sir. Sir, what we call the deficiency of the vitamin C? We can say that one is the scurvy. Okay, the classical symptom is the scurvy is the gum bleeding. ये तो बचपन में से पढ़ गया है, ठीक है. So we have studied this one since from our first standard, right? So the answer will be all the above is the correct answer for this one. It's very very important. So the next question will be like here. So this will be the important again. So which of the following is not the link in the chain of the survival out of the hospital cardiac arrest? Okay, so these situations definitely the examiner will throw in front of you people. That is the OHCA, that indicates outside the hospital cardiac arrest. अगर outside the हॉस्पिटल के बाहर, आउटसाइड द हॉस्पिटल, इफ कार्डियक अरेस्ट हैपन, सो उधर कार्डियक अरेस्ट हो गया है, सो कौन सा है हमारा चैन ऑफ लिंक ऑफ द कार्डियक अरेस्ट का रेस्पॉन्स में नहीं आता. ओके, सो विच स्टेप विल नॉट कम्स अंडर द कार्डियक अरेस्ट रेस्पॉन्स हियर. ओके, सो विच ऑफ द फॉलोइंग इज ए नॉट ए link in the chain of the survival outside the hospital cardiac arrest. Okay, hope the question is clear. And here is the options. Option A, early recognition and activation of the emergency response. So first chain of survival का जो फर्स्ट हमारा स्टेप्स है इधर, दैट इज द एक्टिवेशन ऑफ द इमरजेंसी रिस्पॉन्स इज अ वेरी वेरी इंपॉर्टेंट. एंड इनसाइड, इन केस ऑफ द इनसाइड हॉस्पिटल कार्डियक अरेस्ट हुआ तो फर्स्ट स्टेप ऑफ द चैन ऑफ सर्वाइवल ये होगा अर्ली रिकॉग्निशन एंड प्रिवेंशन. ओके, सो लुक एट दिस वन, updated adult health chain of the survival. Okay, here if the outside the hospital cardiac arrest happen means the first step is the activation of the emergency response. Okay, so after that high quality CPR need to start. After that, as emergency response already we have activated, the defibrillator will come, so we will terminate the arrhythmias if it is shockable rhythm. Okay, so then comes to the get the patient to the hospital, then post cardiac care we have to give, then recovery will start. Okay, so this is the chain of survival given by the our, yes, American Heart Association guidelines, very very important. Okay, so who given the chain of survival, that is the American Heart Association. So first step in the chain of survival is activation of the emergency response system. Okay, it's very very important. Okay, in case inside the hospital cardiac arrest happened, okay, the cardiac arrest happened inside the hospital, the first step of the chain of survival is the early recognition and the prevention. Okay, note the difference here. Here the activation of the emergency response, here it is inside the hospital, means we are all trained healthcare workers will be there in the hospital. First we have to identify it, whether it is a cardiac arrest or any other different situations. Okay, so first we have to recognize that one. So the first step in the chain of survival is the, that is the early recognition. And if it is cardiac arrest, as we are healthcare provider, we have to prevent that one. Okay, so first step in the inside hospital cardiac arrest is the early recognition and prevention. It's very very important, right? So outside the hospital, first step is the activation of the emergency response team. The questions will comes inside in your mind. So in the options, sir, they have given the scene safety. Okay, scene safety and emergency activation. So which one we have to choose first, sir? First you have to choose the scene safety as the first answer. Then after that, choose the emergency activation of the emergency response team. Okay, so first we have to shift the patient to the safe place, so then we have to choose for the emergency response team. So then after that we have to start the CPR. It's a sequence, very very important. Okay, so here's the question, the early recognition and activation of the emergency response team. Yes, this is the first step in the outside hospital, activation of the emergency response team. Then comes to the early CPR with high quality chest compression. Yes, we have to start the early CPR with high quality chest compression. Then early defibrillation with automated external defibrillator. Yes, we have to use the automatically recognizable and terminatable machine, that is what you call as the automatic external defibrillator. Okay, so this one we have to use to terminate the arrhythmia. So it's very important. This is also part of our chain of survival. Okay, so here it is like the defibrillator, automatic external defibrillator, quality CPR, and recognition of early recognition and activation of the emergency response team. So the next step is the post cardiac care arrest. Also, it is there in the chain of survival. But immediate giving the administration of the medication by the paramedics is the not a step of the our outside the hospital chain of the survival. Okay, these questions may strikes in your exam, but it's very very important. So then comes to the next question. So hope it's clear. Outside hospital and inside the hospital cardiac arrest, right? Here is the next question. That is the, which of the following rhythm is considered shockable during the cardiac arrest? Sir, always in every exam this question will comes. I will confuse between whether to choose answer between the CPR as a first or the defibrillator as a first. Or otherwise, I will get confused between whether I have to choose for the defibrillator as a first or the injection adrenaline or the epinephrine as a first. Here is the clear guidance given by the American Heart Association when we have to choose for the defibrillator and when we have to choose for the this one, what we call the adrenaline injection. Bachcho, it's very important what I am showing you here next slide and what I am explaining there. Focus on this particular slide. So definitely this question will come based on the what is your best next step. Okay. So what is your best next step? The question will come. So let me clear this particular question first. Which of the following is the rhythm is considered as a shockable during the cardiac arrest situation? Okay. So here the asystole. Asystole means the flat line will come. Flat line will come. Okay. So for this one, we have to choose first this flat line we have to convert as a arrhythmia at least tachycardia we have to convert like this. Okay, if we convert it on the tachycardia, then give the defibrillator and this one convert to the normal rhythm. Okay, means here to convert from the asystole to the tachycardia we have to give the injection adrenaline. So what is the priority in the treatment of the asystole? That is the injection adrenaline. Very important. Same here, the pulseless electrical activity, same situation here. First convert this one to the rhythm and get to the normal pattern. Okay, so here pulseless electrical activity and asystole, the first step of the treatment is the adrenaline. Okay, so it's not a shockable rhythm. Means first we have to convert this one to the this rhythm, then we can shock. So directly we can't give shock on the this both asystole and pulseless electrical activity. These both are the non-shockable rhythm. Okay, so both that is the asystole and pulseless electrical activity are the non-shockable rhythm. So here the ventricular fibrillation and ventricular tachycardia comes to this slide. Look at this one. So first, when the patient will be, we will find as a unresponsive. Okay, consider this is the patient who is collapsed in the washroom or any road or any highway. So first we have to shift this patient to the safe place. This is always the priority, safe place. Okay, scene safety. Then we have to recognize with the by tapping the patient shoulder. Are you okay? Are you okay? Are you okay? The patient is collapsed because of some hypoglycemia or because of some any other conditions means he will respond. If he is collapsed because of the cardiac arrest, he will not respond. So first recognize. Okay, by asking are you okay? Are you okay? Are you okay? If the patient is not responding, then go for checking the carotid pulse. Okay, check the carotid pulse less than 10 seconds. Why, sir? Why less than 10 seconds? Because already patient is in the cardiac arrest, means the heart is not pumping and the blood is not going to the brain. So if I compressing this carotid artery for the 30 second, 50 second, 60 second, means again the I am blocking the blood which is supplying to the brain. Right? Brain is a vital organ. If the blood supply to brain stop means again the patient will go into the deep coma or my patient may get the stroke here. So don't check the carotid pulse more than 10 seconds. Always the carotid pulse should be checked less than 10 seconds. It is important. Okay. So yes, I have seen sir, but carotid pulse is absent. The carotid pulse is absent means start the CPR immediately. Start the CPR immediately. Okay, till that the automatic external defibrillator it will come. So then attach the pad of the automatic external defibrillator. Okay, so it will automatically identify the rhythm. Okay, if the rhythm is ventricular fibrillation and the pulseless ventricular tachycardia, pulseless ventricular tachycardia and ventricular fibrillation, if the examiner given in the your question, so first priority will go for the shock. Okay, so first priority will go for the shock. That is the defibrillator is the first priority you have to choose. If in case it's a non-shockable rhythm, yes, no. Whether shockable rhythm is shockable or not, it's no. Means it's a non-shockable rhythm. That is the asystole and pulseless electrical activities are the non-shockable rhythm. So give the injection epinephrine as soon as possible. Okay. So simple thing all you people have to choose here. Okay. That is if the patient in the ventricular fibrillation or pulseless ventricular tachycardia. Here the first priority, that is the along with CPR, we have to go for the defibrillator because it's an shockable rhythm. Okay, and make sure while giving the defibrillator, no one should touch the patient. Stop the CPR and give the defibrillator. Okay, before giving the defibrillator, we have to see all length of the patient. No one should touch the blood and bed, and no one should touch the patient also. So we have to say you clear, I clear, all clear. Okay, so no one will be touching to the patient. So start the shock now. Okay, so then again start the CPR. Again start the CPR. Okay, so this is the thing what we have to follow in the ventricular fibrillation and pulseless ventricular tachycardia. If in case the patient will come with the systole or pulseless electrical activity. Okay, these are the non-shockable. We can't give direct shock here. If you are giving also no use of the shock here. Okay, so along with CPR, so the next best step is adrenaline injection. Adrenaline injection. Sir, what is the dose of the adrenaline in the adult CPR? Dose of the adrenaline in the adult CPR is the 1 mg. What is the route, sir? Intravenous. What is the duration, sir? 1 is to 10,000. Okay. So 1 is to 10,000 duration, 1 mg IV. We have to give the adrenaline injection and we have to repeat it every 3 to 5 minutes. Okay. So we have to repeat it every 3 to 5 minutes. So what is the limitation, sir? No limit. No limit for this one. Okay. 1 vial, 2 vial, 10 vial, 20 vial, 50 vial, 60 vial, how many watt you want, you can push. Okay. So no limit for this one. Still, till what time you have to push? Till we have to push that our earth systole. Systole means the flat line should comes to the at least any arrhythmias like this tachycardia or we can like this ventricular fibrillation. Okay, so if tachycardia or VRP is coming means we can convert this one by defibrillating. Then we can give the defibrillator. Okay, in the earth systole we can't give the defibrillator. Okay, so we can give injection adrenaline. Okay, or we can say injection epinephrine, then converts this non-shockable rhythm to the shockable rhythm, then give the defibrillator. Okay, it's very, very important. So here is the question practice on the whatever the concept I have told you just back in the slide. Okay, so what is the first line treatment in the non-shockable rhythm, such as earth systole or the pulseless electrical activity? In the earth systole and pulseless electrical activity, so what is the first line treatment? Okay, so option A is the immediate defibrillation, never ever. As I told, immediate defibrillation should be gone in case of the yes ventricular pulseless ventricular tachycardia. Okay, then ventricular fibrillation. Immediate defibrillator will be the best answer. But here it's non-shockable rhythm, so the best answer is the our chest compression, administration of the epinephrine. This is the important. It will strikes in the exam, and this is the correct answer for this one, right? So and lidocaine infusion. So this one also we can start. So if the epinephrine is not working, means next dose we have to go drug we have to go is the amiodarone. Okay, if amiodarone also not working, means we have to go for the injection lidocaine. Okay, so the question will come: which are the drugs we are using in the uh, adult CPR? That is the epinephrine, amiodarone, and lidocaine. So these three drugs we are using according to the American Heart Association. Okay, very, very importantly, right? So our answer is, for this correct our correct answer for this question is our option B is the correct answer, right? So administration of the atropine and pacing is a treatment in the bradycardia. Is a treatment in the bradycardia. not in trachearrhythmia. So option D I am eliminating, right? So this is the clear and very important for you all. Okay. So what color is the ventricular, vacuotenor tube used to coagulation test in the bone marrow studies? So this question repeatedly coming, repeated question. Okay. So this is the repeated question. Let me change the pen size, please. Wait for a second. This is the repeated question. So this particular question just not like same question. This question means the question on the vacuotenor tube. This one asked in our CRE also, CRE 2025 also, that they have asked on the this tube, that's the EDTA tube. It is used for the hemogram. Okay, what we can say, the complete blood count. Okay, so both are same thing. This question they have asked in the recently our CRE exam 2025 exam, right? So let me comes to the question. This is the question. So which color vacuotenor is the tube we have to use for the bone marrow studies? Yes, our answer would be the green is the answer. Okay, lavender is the this one. We are using this one for the hemogram or the CBC. Very importantly, bacho, this EDTA oil we can use for the HbA1c also. We can use for the cross matching blood grouping. Okay, HbA1c cross matching blood grouping, complete blood count for the and for the erythrocyte sedimentation, right? Yes, sir. Okay, and for the very importantly, we can use this one for the hemogram. Yes, sir. As I told, and hematological examination. So these are the questions. Yes, these are the questions that may comes in your exams. HbA1c test should be done in which vial? That is the EDTA vial. Cross-matching sample should be sent in which vial? That is the EDTA vial. Blood grouping in the EDTA vial. Hemogram or the complete blood count in the EDTA vial. Okay, it's important. Then erythrocyte sedimentation, right, in the EDTA vial. So just we have asked the question, that is the bone marrow. Okay, here the question was related to the bone marrow studies. Which vial we have to send the sample? So that is the heparin vial. That is the green color vial. Okay, that is the green color heparin vial is the recommended for the bone marrow studies. It's important. Okay, so then comes to the our first one, that is the red color one. This is the plain vial. Okay, we can say this one is in the plain vial because inside this one no anticoagulant, nothing is there, just it's an vial. It's a sterile vial, so inside that one nothing is there, so we call that one as the plain vial. So here, if we push the blood inside this plain vial, the blood cells will get settled down easily. Okay, only serums will remain upside, only serum will remain upside here. So that's these serums the lab technicians will use for the serum electrolyte, serum viral markers. Okay, so serology, like viral markers, HIV, HBV, HCV, so we can send with the plain vial. Okay, so where the serum is required for the study, we can use the our very important red color vial because it is not having any anticoagulants, means the blood will clot easily, blood will settle down, and only serum will remains up. So these serums the lab technicians will use for the serum electrolyte. The question will come, the doctor advised for the assessment of the serum electrolyte, like serum sodium, serum potassium, serum calcium to the patient. So in which vial we have to send the sample? Yes, we have to send the sample in the red color vacuotenor. It's important. Then comes to the question which came in the Norcet exam. That is the blood glucose level should be assessed in the which vial? This is the Norcet question, bacho. Okay, that is the sodium citrate vial we can say. So this ash color one. Okay, so this is very important. Again, the question may strikes here. Important one. Okay, last CRE EDT asked, and in the last Norcet, previous Norcet, the sodium chloride vial. That's the for the glucose estimation. We have to use this one also asked in the exam. Then comes to the coagulation studies. PTINR, APTT. Okay, in which vial? So that is the 3.2 sodium citrate vial. Okay, so then comes to the our blood culture, that is the clot activated red color vial, sorry, yellow color vial we can use here. Okay, so the vacuoteners we can see, not vials, sorry. So this is the yellow color vacuoteners. So it is inside the yellow color vacuotener, what is there? Very very important, inside it one citrate is there. So and it is used for the blood culture sample. Okay, blood culture containers with reservoirs, that is the different thing. Okay, so just without any preservatives we have to send blood culture, means we can send in the yellow. Okay, with preservatives means the blood culture sample bottle will come separately. Okay, so that is important. And for the bone marrow studies, green we have discussed, and this is important for the APTT, PTINR. Okay, so coagulation study purpose, which vacuotenor we have to use? We have to use the 3.2 percentage sodium citrate. Okay, so bachcho, just remember at least these three. That is the sodium fluoride, blood glucose level, EDTA, CBC, hemogram, ASR, and cross matching blood grouping HbA1c. Then this 3.25 2% sodium citrate. So for the APTT, PTINR, at least these three, which are most important. Okay, and rest you can remember very easily, right? So here's the next question, and again it is a important question. So what color on the Shakir's tape indicates the severe malnutrition in the critical condition? Severe malnutrition. Yes, I will change the pen color. There is the severe malnutrition. Shakir's tape. Which color, which indicates the severe malnutrition in the Shakir's tape reading? So this is what we call as the Shakir's tape. So we will use this one to check the mid upper arm circumference. Okay, so how we have to check the mid upper arm circumference? So this is the shoulder and this is the elbow. Okay, so here will be the olecranon process and here will be the acromion process. This is the acromion process and here is the olecranon process. So in between here, the midpoint between the olecranon process or the acromion process. So this is what we call the mid upper arm. So with this particular Shaker step, we will check the circumference of this mid upper arm. We call that one as the mid upper arm circumference. Okay, which is a age independent reading for malnutrition. So why it says independent, sir? Means from 6 months to 5 years, or we can say 69 months. So the mid upper arm circumference will not change. It will remain constant or little bit change will be there. So based on the age, it will drastically, it will not change. It will be remains constant. So that is, it is not dependent on the age. So we can say that one. Okay. So it's very, very important. Just a second, please. Okay, this is the completely age independent reading, which will be tells the mid upper arm circumference. That is the Shaker step reading. Very very important. And this image based questions also it will strikes in your exam. Okay, so that is the IBQ also very very important on the Shaker step. So look at the Shaker step. It is having the three readings. Sorry, three color codings. One is red, one is yellow, and one is green. So the red, yellow, and green is there. So this green is normal. Okay, this yellow is borderline malnutrition and this red is the severe malnutrition. Okay, so the malnutrition starts with the yellow, that is the borderline malnutrition, and red is the severe malnutrition. So then comes to the reading, proper readings. Okay, so the green is normal. Normal means it's more than 12.5 centimeter mid upper arm circumference, that is the normal. If it is yellow means it is borderline, means it is between the 11.5 to 12.5 centimeter mid upper arm circumference, that belongs to the Yellow. Okay, that's the borderline malnutrition. If in case, if in case it is less than 11.5 centimeter, so which is called as the severe malnutrition. We can say this one as in the severe malnutrition. Okay, very important. The severe malnutrition. So blue is not a part of the our Shaker step reading. So this is very important. Bacho, remember the question will come from the. So what is the mid upper arm circumference of the child, where we can say that one is the severe malnutrition, that is the less than 11.5 centimeter. Okay, so the borderline, which color indicates the borderline? That is the yellow color indicates the borderline, and the reading between the 11.5 to 12.5 centimeter, and green is the normal indicator where the normal nutrition baby will be there. So it's in more than 12.5 centimeter, and the Shaker step mid upper arm circumference is the, yes, the age independent criteria, very important. So it may strikes in the exams very importantly. Okay, so don't forget these words: age independent criteria, then the this gradings. Okay, so here is the next question. So what the next question is telling, which of the following is key characteristics of the chronic malnutrition? Bacho, this particular questions, it will not only comes in your prelims, it will definitely comes in your prelims plus mains both. Okay, so don't miss this question. Okay, try to answer for this one. Which of the following is a key characteristics of the chronic malnutrition? Consider the chronic malnutrition. You people only will tell the answer. This is the child. He is malnourished from this since from last 5 years. 5 years, since from last 5 years, the child is malnourished. Means we can say this one is in the chronic malnutrition. Chronic malnourishment, right? So here, what happens to the weight of the child? Weight also decreases. And what happens to the height of the child? Since from the last 5 years, there is no proper nutrition. Height also decreases. Okay. And the next situation is, this is a child. Okay. Since from the last 15 days, he is not getting the proper nutrition. Okay. So that is what you call as the malnutrition. Last 15 days means we can say that is the acute. Okay, short duration only. Acute malnutrition. In the acute malnutrition, whether the weight decreases or not, yes, weight will decreases. In last 15 days, there is no proper nutrition. Whether the height will decreases in the acute malnutrition, no. But your height will not decreases. Height will decrease only if there is malnutrition chronically. So best indicator of the chronic malnutrition is decreased height for age. Okay, so decreased height for age is the best indicator for our chronic malnutrition, because of the chronic malnutrition height will decreases. Okay, and what is the best indicator for the acute malnutrition? For the acute malnutrition, the best indicator is the low weight. Okay, so because of the acute malnutrition, if the patient is not having proper food since from last 1 month or 15 days, the weight may get decreases. The decreased weight for height is the very importantly, that is the acute malnutrition, and decreased weight for age is the acute malnutrition, which is converting into chronic malnutrition. Okay, so that is what you call as the acute on chronic malnutrition. Okay, so decreased weight for age is acute on chronic malnutrition. Decreased height for age is the chronic malnutrition. Decreased the weight for age is the acute malnutrition. Decreased weight for height, not for age. Okay, so decreased weight for height is the acute malnutrition. Very, very importantly, these questions will definitely strikes. Okay, let us practice the one more question on this one. Okay, yes, which of the following is commonly used to measure acute malnutrition in children under 5? Okay, under 5 children are there. Among those children, so which one we have to use as the treatment of the acute malnutrition? Sorry, to indicator of the acute malnutrition. Yes, decreased weight for age. Can we use this one? Bacho, just now only I have discussed decrease the weight for age is the acute and chronic malnutrition, not just acute malnutrition. Okay, it is acute and chronic malnutrition. Right? So this is not our answer. So height is decreasing. Height is decreasing means this is the chronic malnutrition. Right? This is the chronically the child is malnourished. Okay. So if the weight for a height is decreasing means it is indicating the acute malnutrition. So that is our correct answer. For acute malnutrition, child under 5 years, that is the very, very importantly, our height, weight for height will get decreases. So it will be important for you all. Clear, Bachu? Clear? Yes. So here is the next question. And again, very, very important question. What is the question? Which of the following is not a common diagnostic criteria for severe acute malnutrition? Okay. So that is the answer you have to tell, which is the not a common feature of the or the common diagnostic criteria of the SAM. Okay, SAM babies. SAM is the severe acute malnutrition. According to the WHO criteria, there is criteria of the yes, the severe acute malnutrition. So which one that one? Option A. Sorry, the question asking that is which of the following is not a common diagnostic criteria of the SAM. Okay, we have to choose which one is not a feature of the SAM. So option is the mid upper arm circumference less than 15 centimeter, less than 11.5 centimeter. Yes, this is the our diagnostic criteria. Bilateral pedal edema is there. Yes, it's an also diagnostic criteria. Weight for height. Look at this one, bacho. Again, the weight is decreasing for the height, so that is the acute, severe acute malnutrition. In the Z score, it is less than -3 standard deviation. Okay, yes. So this is the diagnostic criteria of the SAM, and the option D is not our answer yet. So this will come in the diagnostic criteria because here the weight for age is decreasing. So weight for age is the acute and chronic malnutrition. So it's not only indicating the acute malnutrition. The question is about the severe acute malnutrition. Okay, and it is just decreased less than -1 standard deviation only. So this is not our answer. So not a diagnostic criteria. That is the option D. Okay. So take a screenshot of this one and revise once. The criteria is the weight for height. Here Z score is less than -3 standard deviation, -3 standard deviation, and mid upper arm circumference is less than yes 11.5 centimeter. Just I have told bacho less than 11.5 centimeter. That is the severe malnutrition, right? And if the weight for height is decreasing means that is the acute malnutrition. Okay, so both we can say that is the severe acute malnutrition, and as of due to the loss of the protein in the acute malnutrition, there is edema also there. Yes, that is what we call as the bilateral pedal edema. So this is the diagnostic criteria of the our SAM. Very, very important. Severe acute malnutrition. It will be helpful for your exams in the upcoming exams, right? So here is the next question for you all. So what is the BMI range for the obesity class 2? For the obesity class 2, what is the BMI range? What is the BMI? So that is the basic metabolic, body mass index. This is what we call as the body mass index, or we can say the quitlet index. Quitlet index. So the question will come. What is the another name of the BMI or the body mass index? That is the quitlet index also we can say. very importantly. Okay, so what is the class 2 obesity here? Yes, as for the WHO guidelines of the BMI, so underweight, the normal would be BMI should be 18.5 to 24.9 kg per meter square is the normal. Okay, if it's less than 18.5, so that is the underweight. Okay, so that is the underweight. If it is more than 24.9, that is the overweight. Okay, from the 25 to 29, it's an 25 to 29, so that is an overweight. From the 30 to 34.9, so that is the class 1 or the moderate obesity. And if it is 35 to 39.9, so that is the our class 2 or the severe obesity. And if it is more than 40 kg per meter square, that is the class 3 obesity or severely morbid obesity, very dangerous obesity, where we have to go for the bariatric surgery. Okay, so it's important, it's very important. This is given by the WHO criteria. Read this one only for AIMS. Okay, so AIMS will ask the question from here only, and many other institutes also given the grading of the obesity, but you have to read this one only for the AIMS exams, because many times the questions came from the here only. Okay, so that is the important. So let's come to our question. What is the BMI range for the obesity class second? So look at the option in 18.5 to 24.9 per kg. This is the what we call as the normal. So what we call this one as in the normal. And 25 to 29.9, so this one is the overweight, right? It's an overweight. From 30 to 34.9 is the obesity class 1, and from 35 to 40, that is the obesity class second. If more than 40, that is morbidly obese, or we can say severe obesity, very severe obesity, not severe. Severe obesity is the class second only, and it is a very severe obesity. Focus over the words here. Okay, if the examiner given the very severe obesity, means you have to choose for the this one. Just severe obesity, we have to choose for the this one, or the grade 2 obesity, we have to choose for the this one, 35 to 39.9 kg per meter square. So these are all very high yield questions, gradings, image based questions, WHO classifications, and diagnostic criteria, malnutrition, indicators of the malnutrition, what is the indicator for the acute malnutrition, what is the indicator for the chronic malnutrition, everything we have discussed. Lot of the concept, lot of the important questions, and lots of the important image based questions on the bite out spot conjunctival xerosis we have discussed. Very importantly, most of the questions we have discussed are the WHO classifications. So in every exams, definitely one questions will comes from the WHO classification. So we have discussed in detail completely. So that is necessary for your exams. So this was the first class of the what we can say, the Norcet special classes. So in the next classes also I am going to include very important concept on the research. Okay, where I am describing you a question that is definitely coming from the research every time. Okay, so and other medical, surgical, nursing questions, fundamental of the nursing question, pediatric questions, pharmacology questions, which is very important. That one I will definitely make you a revise here. So don't room here and there. Don't watch the classes where they are like wasting your time. So wherever the classes will be there for to boost your content and boost your knowledge and making a revision very quickly, so those kind of the classes wherever it may be, you can watch that one. Okay, so time wasting class, the dialogue class, don't watch that ones. Okay, it's a clear suggestion from my side. Okay, so dialects are not going to decide your ranks, the content and quality of the content is going to decide your rank. So we are always behind to give the quality content. Okay, so stay connected, stay motivated. If anyone is new to the our video session, please do subscribe to the channel. Okay, so it will get notified to you for the next question, session also. and timings of the sessions we will share in our WhatsApp group, Telegram group. I will give the link to the our WhatsApp group and Telegram group, so please do join to the link. And as all of you know that we are having the beautiful master nursing classes application, where we have launched the best and very best question sessions test series for the Norcet 8 and upcoming RRB exams. So you can enroll, download the app and enroll the test series also. It's very affordable price. Okay, so we'll meet again in the next classes. So stay connected, stay motivated. We will meet again. तब तक के लिए जय हिंद, जय भारत. If you found the class helpful, so please mention MNC is the best. Thank you.